my name is Mary Rye. My presentation is on sex trafficking and mental health, coping with the aftermath of abuse. Sex trafficking is defined as involving some form of forced or coerced sexual exploitation that is not limited to prostitution and has become a significant and growing problem in both the United States and the larger global community. Sex trafficking may also include commercial sex work, pornography, exotic dancing, stripping, live sex shows, mail-order brides, military prostitution, and sexual tourism. Statistically, there's approximately 800,000 individuals worldwide, 80% of which are girls and women, 50% of these being minors. For migrants, marginalized, and impoverished people, the threat is greater for sex trafficking. And then victims are mainly solicited from East Asia and Mexico, the former Soviet Union, Eastern Europe, Africa, and Latin America. Sex trafficking and mental health. Victims may develop adverse physical and psychological health conditions and social disadvantages. Survivors are often left with depression, PTSD, anxiety. There's thoughts of suicide. The way they see themselves is perceived differently and negatively. They also cope with psychotic and mental disorders. There's fear of communicating what happened to them to others. And they also may not remember much or any of their experiences. Factors involved in sex trafficking. Studies that led to the information here were based on the victim's point of view and illustrates how complex it is for victims to actually leave sex trafficking. So first steps would be to exit or be rescued, which means they have to actively move forward trying to get out of the sex trade, and then eventually begin the reunification processes with family or friends of their old ways, their old lives or new lives. With this, there have found to be 3 levels of intervening factors. So there's individual, relational, and structural. Within these are 3 subcategories of these factors. So facilitating involves spirituality, which gives the victim or survivor a feeling of purpose and meaning, and then makes them able to trust in their ability to have success with moving out of the sex trade. Hindering means there's more susceptibility to uselessness, feelings of shame, there's stigmas and labeling from others. Also, there may be lack of money and stability, just kind of ways that prevent them from moving forward. Controversial factors are addictions to drug and alcohol. There's also shame and disgrace inflicted from family or society. Their community is a big factor. Exploring mental health systems. It is important to note here that professionals must take many factors into consideration in order to help. So this includes addressing both the current and historical experiences of victims. So the first thing is establishing trust, so making sure that survivors feel safe, that they're able to talk to, and what they tell the providers won't go any further to affect them more negatively. Professionals can contribute resources, especially local ones, so it's easier to help the person move forward without having time off in between help and getting out of the sex trade so they don't fall back on the sex trade. Education about privacy and therapy, just reiterating the fact that there are places and people that they can trust and move forward with, sharing their experiences and knowing that no more harm will come to them. Improving on coping skills and self-esteem are highly important as a way to keep them moving forward. Acquiring these skills helps with their strength and relying on themselves and knowing that they can be successful on their own. Crisis stabilization. Modalities used for these victims are often narrative exposure therapy, NET, there's trauma-focused cognitive behavioral therapy, and then eye movement desensitization and reprocessing, EMDR. When treating survivors, professionals are also affected. So they can develop secondary, which are vicarious traumas, which develop as they help the survivors. So as the treatment progresses, these present in forms called secondary traumatic stress, STS, and countertransference. So this occurs when the therapists are treating someone, they over-identify with the traumas experienced by their patient. So they take on what the patients have endured. So symptoms here can present in apathy, anger, withdrawal, sleep issues, and anxiety. And then it can have either a negative or positive effect on the professional. So it's been found that despite negative effects of treating survivors, professionals experience high levels of work fulfillment called compassion satisfaction, which makes them feel like they're making a difference. Globally, sex trafficking is a thriving business and has an annual value of $32 billion. Some of the reasons for this includes thriving sex industry, ease of travel for tourists, migration policies of governments. There's little aid from governments regarding preventative actions and punishing offenders, and then also women have very little power, if any, against perpetrators in a lot of the countries listed. Looking closer at the global perspectives, in addition to what is shown here, sex trafficking victims show to be 73% Latin American and Caribbean, 15% are from North America, 8% from Asia, 3% from Europe, 2% from Africa. And then additionally, females are the majority in both sex and labor trafficking, while males are mostly labor trafficked. To help, non-governmental organizations have begun to step in along with other organizations. There has been a regional plan of action and regional task force installed, and then all involved are taking part in strategically working against prevention and finding solutions. There are many ways human service professionals and providers can help. After finding their way out of sex trafficking, many survivors now face issues with housing, family, finance, health, and legal issues. As they move forward, so provider support is vital here. This can be done by identifying victims and survivors, providing resources and support, advocating, utilizing technology, reaching out, confronting barriers, use of principles of care and treatment guides, and committing to research for survivors. While this is a difficult issue to fight against, it is important to keep moving forward and keep up the hope that help may reach many. Thank you.